Okay, everybody. So we were talking about the integumentary system that consists of skin, hair, nail, and glands. In last lecture, I have talked about the main part of the integumentary system, which is the skin. So we have talked about the skin as well as the glands of the skin. We have talked about different types of glands present in the skin. So today we'll talk about the hair first, then we'll talk about the nail. Those are accessory structures of the integumentary system. First, we'll talk about the hair. Hair are dead structures, not alive. They are formed by dead keratinized cells. And these dead keratinized cells are heavily filled with keratin, that is special protein. That's why it is called keratinized cell, because these cells are dead and they are filled with that special protein that is called keratin. And the keratin present in the skin and in the hair are different. In the hair, the keratin that are found is hard. In the skin, the keratin is soft. And this keratin in the hair is more durable than the soft keratin of the skin. Okay? That's why, after death, the hair is not destroyed easily. It will stay, intact for a long time because it contains hard, durable keratin. Why the color of the hair is different than the color of the skin? Because the skin has keratin, hair also has keratin. Why the color of the skin and hair are different? Because in the hair, the presence of lot of melanin makes the color of the hair dark. So the pigment melanins usually brown to black colored pigment. Sometimes melanin is yellow or rust brown, but most of the time melanin is black. And when we get old, the synthesis of melanin decreases, and that's why the color of the hair turns to white or gray due to lack of production of melanin. Now, the structure of the hair. If you cut the hair and see under the microscope, you will see three layers in the shaft of the hair. Which part of the hair is the shaft part? That part you can see from outside. So the hair that you see from outside, that is the shaft. So if you cut the shaft and see under the microscope, you will see three layers in it, from outside to inside: cuticle, cortex, and medulla. So outermost layer is the cuticle, and then middle layer is the cortex, and innermost part is called the medulla. Okay, so like this, if you see under the microscope, cuticle, cortex, and this part is called the medulla. Okay, the cuticle, the outer layer, gives the shiny appearance of the hair. Now, if you see the follicle which is inside the skin. Shaft is the outside, okay? So what happens in the follicle, you see this is the shaft and this part is the follicle. So this part you can see from outside, that is the shaft part. It has 3 layers. Now follicle is here. What happens in the follicle, inside the follicle you have the shaft. You see here, look at me, goes like this. So now if I see cut here, what I'll see shaft inside, that means those 3 layers, and then extra layers around the shaft in the follicle. So this is the follicle, this is the shaft. So inside the follicle you have the shaft, okay? So now if you see, cut the follicle and see under the microscope, inside part is the shaft, that means those 3 layers. You see inside part, medulla, cortex, cuticle, from inside to outside. Then what are the additional layer in the follicle? First, internal epithelial root sheath, then external epithelial root sheath, glassy membrane, and so those are the another one is connective tissue root sheath. So those are 4 additional layers around the shaft in the follicle. Okay, so what are those additional layers? I am going to mention again: internal epithelial root sheath, external epithelial root sheath, glassy membrane, and connective tissue root sheath. So remember those layers, that is important. I will ask a couple of questions from here. The structure of the hair. Now, in a hair, you will also find hair bulb, expanded deep end, and around the hair bulb you have receptors. Okay, and those receptors are the touch receptor, sensory nerve endings, and also erector pili muscle, that tiny muscle present in the dermis, is attached to the hair follicle. So lower end is called the bulb, the expanded part of the hair follicle, and around the bulb you have the receptors, nerve plexus, and erector pili muscle attached. And this tiny muscle, erector pili muscle, is responsible for goosebump. You know that when you feel cold or get scared, hair erect. So what happens? This is the hair follicle. See here, this is the hair follicle. Erector pili muscle is attached like this. So normally the hair lies on the skin like this, right? And when you get scared or cold, then this muscle, this is the erector pili muscle, this muscle contracts and pull the hair like this. So this muscle helps in the goosebump. Here you see the bottom part of the hair. So you already know that you have shaft inside. So you see cuticle, cortex, medulla inside, and those 4 additional layers around that. And in the very bottom part of the hair, you have the papilla, hair papilla, that is important, from where you have the hair grows from there, because you have the stem cells there. So the hair papilla is filled with stem cells. So the cells produce new cells, and those new cells help to grow the hair. Okay. So these are alive cells, but the shaft of the hair is completely dead keratinized cells. Types of hair. 2 types of hair are found in our body: vellus and terminal hair. Vellus are pale fine body hair of children and adult female. Those are soft, fine, pale colored hair. Terminal hair are coarse, thick, and long hair of the eyebrow, scalp, axillary and pubic areas. Okay, in both male and female, and in the face and neck of male. So terminal and vellus, those are two types of hair. Baldness. Two types of baldness occur in human: alopecia and true or frank baldness. Alopecia occurs to everybody, both male and female, and everybody. After age 40, we start to lose hair. We lose a lot of hair. Hair gets thin, and that is called alopecia. True or frank baldness is genetically determined. Complete loss of hair. You'll see shiny skin on the scalp, right? Like no hair at all. So that is true or frank baldness. And if the parent, father, has baldness, then the son usually gets true or frank baldness, because this is genetically determined baldness. And there is a chemical that is called dihydrotestosterone. Dihydrotestosterone, or DHT, precursor of male sex hormone testosterone. So DHT inhibits the hair follicles to grow new hair. So if someone has more DHT, the baldness, the chance of baldness is more. Okay, so more DHT can inhibit the formation of hair. So those are two types of baldness. Regulation of temperature. Your integumentary system plays important role to regulate the body temperature. You know that when the body temperature increases, sweating occurs from the sweat glands. Eccrine sweat glands release highly watery sweat. So sweating is one way we lost water, we lost heat from the body. Okay? So sweating, number one. Number two, by increasing blood flow in the skin, So these are two ways the body loses heat: by increasing sweating and by increasing blood flow in the skin. Now, who controls how much sweating should occur, how much blood flow should be increased? Your brain. You know that brain controls everything. So your brain has a structure that is called hypothalamus. So this hypothalamus controls the sweating and the blood flow, amount of blood flow in the skin. Now what hypothalamus does, if the body temperature increases, hypothalamus detects that and sends signal to the sweat gland and tell the sweat glands to release more water. Water gets out, that takes a lot of heat out. Number two, hypothalamus sends signal to the blood vessels of the skin and does the vasodilatation. Dilate the blood vessels of your skin. So what happens? More blood flows in the skin, makes sense? And heat gets out from the blood easily. Okay, so those are the two ways your body temperature is regulated by the integumentary system and how hypothalamus works. If the body temperature falls, Then what happens? Your skin decreases the sweating. That is one way. Number two, this is more important, increases the contraction of the skeletal muscle. Contraction of skeletal muscles. Let's first talk about this one. You know, in hypothermia, that means if your body temperature drops, like if you go outside without enough clothes in winter, right? Then shaking, shivering of the body occurs. That is what? The contraction of the skeletal muscles, right? Shivering occurs. To increase the body temperature, we know that when muscle contraction occurs, metabolism increases. When you do exercise, right? Body temperature increases. So metabolism increases and metabolism produces heat. So the body temperature will go up. That is how the muscular system increases the body temperature. It is not the integumentary system. Make sense? Muscular system. Now, what the integumentary system does, you must remember that your sweat gland is like this. There is a duct and there is a pore that I showed you in last class. This is the sweat gland. This is the duct and this is the pore. So what happens when the body temperature falls in cold weather? Constriction of the duct and the pore occurs. So pore gets almost closed because of constriction. Ducts gets very narrow because of the constriction. So the sweat cannot get out. So no sweating will occur or decrease sweating. Make sense? The duct gets constricted, the pore gets narrow, is smaller. So sweating will not occur. And heat will not leave the body. If sweating doesn't occur, no heat will leave through the water. So those are two ways how the body temperature will increase in cold weather or hypothermia. Dermatitis. Dermatitis is the inflammation of the dermis. Itis is the inflammation, you know that. So, inflammation of the dermis of the skin, which is the inner layer of the skin. And you already know that dermis has two layers. I actually mentioned dermatitis in last lecture. Outer layer of the dermis is the papillary layer, which is formed by loose areolar tissue. And inner layer of the dermis is dense irregular. So dermis has two layers. 20% thickness is given by the papillary layer and 80% is given by the reticular layer, inner layer. Now, this is loose areolar, loose type, you know that, areolar tissue, connective tissue. And this is dense irregular. Remember, dense irregular. Okay. Now, you know that loose type of connective tissue is loose, so the inflammation or damage can occur easily in this layer because this is loose. In dense connective tissue, you know that fibers are heavily packed, so the structure is very strong, will not get injury easily. So inflammation is usually due to the injury of the papillary layer, which is the outer layer of the dermis. Now, inflammation can occur by infection. Microorganisms can enter and spread easily in this layer because it is soft. Microorganisms cannot easily enter into the hard structure. So bacteria, virus, fungi, they can do inflammation. Radiation, you know that UV radiation, if you go under the sun and stay there a long time, redness of the skin occurs, right? That's the inflammation due to radiation. Mechanical irritation. If you know scratch in the same place again and again, that will cause inflammation, right? That's the pressure by scratching. That is an example of mechanical irritation. Chemical. Some chemicals cause inflammation of the skin, like poison ivy. You know that that causes redness, itchy, pain, all those symptoms, edema. So inflammation occurs due to those factors. Can occur by different factors. Now, inflammation, the signs of inflammation you already know. I have talked about that. So same thing. Uh, Redness, swelling, pain, slight increase of temperature, those are the signs of inflammation. It happens in the skin very often. Cancer of the skin or skin carcinoma is commonly heard clinical condition. Good thing is that most of the skin tumors are benign, not malignant. Most of the skin tumors are benign type, which is less harmful or not harmful. Malignant type tumor is the cancer and more harmful, so which is good. What are the risk factors for the skin cancer? Overexposure to UV radiation. Excessive exposure to UV radiation can lead to skin cancer. You know that UV radiation can pass through the layers of the skin, okay? And particularly if you have less melanin in the skin. You remember in last class I said melanin makes a protective shield layer that stops UV radiation, right? So if you have less melanin, then the UV radiation can pass more easily and enter into the very deep cells of the skin and can cause the damage of DNA. And when the DNA is damaged, then cells start to behave abnormally because DNA controls the behavior of the cell, okay? So cells start to multiply uncontrolled abnormally, and that is cancer. So uncontrolled abnormal multiplication of the cells due to damage of DNA, makes sense? By UV radiation, that leads to skin cancer. So now you know that dark skin is more protective against UV radiation, right? So if someone has like darker skin, that skin is more protected against UV radiation. Frequent irritation of the skin by any means. It could be chemical irritation, mechanical irritation, right? Any form of irritation. If you frequently do that at the same location, that can change the behavior of the cell, and cells may start to behave abnormally and multiply abnormally. Okay. For example, you know those people who work to fix the road or build the road, they use the tar, right? The dark chemical tar, and that is very harmful. If you touch every day, that chemical touches your skin frequently, that can change the behavior of the cell. Okay, DNA change the DNA, and the cells can multiply abnormally. So that is why they need to make sure they put on gloves. Sometimes you'll see in the stores they sell the lotions and says that it will fix that. It can protect the UV radiation, protect from the UV radiation, but it cannot fix the damaged DNA. It is almost impossible. The genetic engineers, they are working now to see how to fix the DNA, but still we are behind. So don't trust them. But some lotions can stop partially the UV radiation. It's very difficult to stop the UV radiation. Some lotions can do that, block, but none of those can fix the damaged DNA. Three types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. So those are three types. Basal cell carcinoma are least malignant and most common, which is good. That means the most common type of skin cancer is least malignant, less dangerous. And basal cell carcinoma occurs due to abnormal multiplication of the cells in the stratum basal. You remember there are 4 or 5 layers in the epidermis, right? Innermost layer is the stratum basale. That's the innermost. So if the cells of that layer multiply abnormally, that's the cause of basal cell carcinoma. Squamous cell carcinoma is the second most common type of skin cancer, and it is more malignant than basal cell carcinoma but less malignant than melanoma. And melanoma is the most dangerous, most malignant type skin cancer, but it happens least, so which is a good news. You know that melanocytes are the cells that produce melanin, right? Melanocytes of your epidermis start to multiply abnormally, and that leads to melanoma. So melanin producing cells behave abnormally and multiply abnormally. That's the melanoma. Here you see basal cell carcinoma. Stratum basale cells proliferate and invade into dermis and hypodermis. Now, the cure of basal cell carcinoma is almost 99% cases you can cure the patient by surgical incision. Remove the tissue. That will cure in 99% cases. So it is easy to treat. And squamous cell carcinoma involves keratinocytes of stratum spinosum in that layer. The cells start to multiply abnormally, and most common on scalp, eyes, ears, lower lip, and hands. In those areas, we see squamous cell carcinoma occurs more. On the scalp, ears, lower lip, and hands. And good prognosis if treated by radiation therapy or removed surgically. So actually we do both. First we remove the tissue from there and we then give radiation to kill the nearby cells. But you can choose either radiation to kill the cells, abnormal cells, or surgically remove the abnormal cells or tissue from there. Or you can use both to make sure that you have killed all the abnormal cells. Melanoma involves melanocytes, melanin producing cells. Now, melanoma is easy to diagnose by looking at the color. You know, melanocytes produce melanin, right? So if in one area you have a lot of melanocytes, that means what? More melanin is being produced in that area. Is it clear? So the melanin will be produced more in that area because more melanocytes are there, and the melanin, the color of the melanin will give the color of the tumor or cancer. Okay, because more melanin will be produced by more melanocytes, and that's why the color of melanoma is dark black, brown, tan, and sometimes it could be red or blue, depending on the color of the melanin that person has. And highly metastatic and resistant to chemotherapy. Metastatic means the cells can spread into the deep tissues far away from the site of the cancer. So from outside you may think that cancer is only in this area. The cells are only in this area, but actually the cells go far away from the site. That's why you need wide surgical excision, because you don't know how far, how deep the cells, abnormal cells, have invaded. That's why you need widespread surgical removal. And immunotherapy is another way to treat the melanoma. You inject antibodies that will go and find those abnormal cells inside your body and will destroy them. That is the immunotherapy. We inject antibody from outside, right? So they will go and find the abnormal cells, will bind with them and will destroy them. Anyway, so melanoma is the most dangerous type skin cancer. Burns. We also often hear the term burns. Skin covers the body. So if anything that tries to burn your body, like heat or UV radiation, your skin first takes that heat, and that's why burn occurs in the skin most of the case. What can cause burn? Heat, electricity, radiation, and certain chemicals. For example, acids burn the skin. Now, two things are the main concerns of burn. Two things. One is dehydration and another is electrolytic imbalance. When burn occurs, you know that fluid comes out from the body, right? You have seen fluid comes out from the body. So, lot of water comes out, that causes dehydration, loss of water, and that fluid or water contains a lot of electrolytes, sodium, potassium, right? Chlorine, those electrolytes also come out. So, loss of electrolytes cause electrolytic imbalance in your body, and both are the risk factors or the concerns of burn. So to treat the patient, you first have to give water, and also you have to see which electrolytes the patient needs, and immediately you have to give the electrolytes. Now, depending on the amount of damage in the skin, we classify the burn into three types: first degree burn, second degree burn, and third degree burn, depending on the amount of damage in the skin. If you see only the outer layer, which is the epidermis, is damaged, in that case we say first degree burn. The signs of first degree burn are redness, edema, swelling. Edema is swelling, accumulation of fluid, and pain. If you see the epidermis and the dermis, partially damage of the dermis has occurred, that is called the second degree burn, the outer part of the dermis. So not the complete damage of the dermis, only the outer part of the dermis and the entire epidermis. In that case, we will say second degree burn. And in that case, blisters appear and you will see white patches. Third degree burn. If the entire skin, that means both the epidermis and the dermis, are completely destroyed, that is considered as third degree burn. And in third degree burn, interestingly, no sensation of pain. The patient doesn't feel any pain. Why? Because the entire skin has been destroyed. So what happens? The nerve endings of the skin are also completely destroyed. Make sense? So there is no nerve ending left there. So you won't feel any pain. No edema occurs because the blood vessels have been destroyed too. And no skin is left there, so no edema, no accumulation of fluid in the interstitial space. In third degree burn, since the skin has completely destroyed, you remember that when we talked about the epidermis, it has 4 or 5 layers, and innermost layer is the stratum basale, where you have the stem cells, a single layer of stem cells, and from there new skin cells are produced, right? From the stem cells. Now if the skin is entirely destroyed, in that case stem cells are destroyed too completely. So no skin will be formed. But if it is partially damaged, like first degree or second degree, you have some stem cells left there, so the skin can be reproduced. So just know that due to the damage of the entire skin, no stem cells are left in the skin there. So you need grafting. You need to take skin from another part of the body and then put in that area. Here you see in the hand of this patient, in some areas first degree burn and in some areas second degree burn. Make sense? First degree burn, redness, swelling, and second degree burn, you'll see white patches appear. Here this is the third degree burn. Okay, it's very kind of not good looking. So third degree burn, the whole skin has been destroyed, so you need grafting here, put new skin. Okay, now another thing, it's not in your slide, I will just mention the distribution of burn. How much burn has occurred? Percent distribution. Okay. We say the percent distribution of burn to determine how much body surface has been affected, and there is a method to do that. 9 times 11 plus 1, that is the rule. Okay, 9 times 11 plus 1. So 9 times 11 is what? 99 plus 1 is 100%. Now what are those 11 nines? See here, the head part is considered as 1 9. So your head is 1 and the upper limb is 1 9. So you have two upper limbs. So upper limbs 2 9 9. Okay, this is 9, this is another 9. So head is 1 9, each upper limb is 1 9. So from upper limb you get 2 9s. Let me write this way. Okay, then the trunk, the entire front of the trunk is 29 and entire back of the trunk is 29. So this is 29 and the entire back of the trunk is 29. So trunk is 4 9. 29 in the front, 29 in the back. Make sense? So you got how many? You got 1, 2, 3 and 4 is 7. Then the lower limb. Each lower limb is 2 9. Front is 1, back is 1. So each lower limb is 2 9. Each upper limb is 1 9, right? Each lower limb, lower limb is much bigger than upper limb. So each lower limb is 2 9. So lower limb is 4 9 because each is 2. Okay. So you got 11 nines, you see. So that is 99%. Now what is 1%? 1% is the genital area. Okay. So genital area is this 1%. So that's how we measure the percent of burn that has occurred in the body. That is called 9 rule. Nail, another structure of your integumentary system, nail. And if you see the structure of a nail, you have different parts in it. You have body of the nail, tree is root, nail folds. There are proximal and lateral nail folds. Eponysium, hyponysium, or you can say eponysium, hyponysium, nail bed, and lunula is the white part. You see in the back of the nail, body of the nail, you have tiny white area. That's the lunula. So here you see some of those parts. You see the nail body. This part is the body. This part. And then the extended part here, that is the free edge. Sometimes you like it to grow a lot, right? So particularly the girls. So that's the free edge. Under the free edge, there is no bed. But under the body, you have the bed support. And in the back part, behind the body of the nail, you have that white crescent shaped area. That's the lunula. And then you have lateral nail folds in both sides of the body. You see, both sides of the body, lateral nail folds, and in the back, behind the lunula, you have the proximal nail fold. Okay, so 2 lateral nail folds and 1 proximal nail fold, and those are the things you can see from above. Now if you see under the body of the nail, you have the nail bed. So body rests on the bed, and under the beginning of the free edge, at the tip of the finger, you see there is a tiny tissue structure under the free edge at the tip of the finger, that is called the hyponysium or hyponysium. That is small tissue that attaches the free edge to the fingertip. And there is another small amount of tissue that connects the lunula to the skin, that is called the eponysium. Okay, so hyponysium and eponysium, small tissue structure in those two locations. Okay, Now, you see the part of the nail that we don't see. Which part we don't see? Behind the lunula. The part enters into the finger, and that part is called the nail root. So nail root is the part which we don't see from outside, located inside the finger, and that's the extended part from the lunula. Okay, nail root. In the nail root, you have the stem cells in that area, like the hair root, and new cells are produced from there. So those are uh, the cells that are produced to produce new nail tissue. And you know that nail grows, right? But if you see the cells in the nail, in these parts like face, body, or even here, these cells are dead cells. Only the stem cells are alive cells, right? So nail is also a dead structure formed by the dead keratinized cells. Same like your hair, dead keratinized cells. Nail is also dead keratinized cells. These cells are heavily filled with keratin, that is special protein. Now you can think, why then the nail color is white? Color is different than the color of your hair, because in the hair you have melanin, right? Plenty of melanin. In your nail you don't have any melanin. In your skin you have a small amount of melanin. In your hair you have plenty of melanin, and your nail you don't have any melanin. Make sense? So which one is the real color of the keratin? What do you think? The real color of the keratin. Yeah, because there is no melanin here, right? Only keratin. You have plenty of melanin here, right? So that's not the real color, because keratin get mixed with plenty of melanin, right? In your skin you have also melanin. So this is the real color of keratin, the color of the nail, because no melanin is mixed in keratin there. And you know the protein, have you seen the egg? Inside the egg, the protein part, it's like your color of your nail, right? It's like transparent whitish color. So that is the real color of the protein. Okay, so that's all you need to know from the integumentary system. So if you have any question, you can ask me.